Nobody likes having a tooth taken out, but what you do after the extraction can make all the difference in how you heal. My name's Dr. Ilyas and I'm a dentist. In this video, I'll be giving you top 10 tips on how to heal fast after an extraction. The main objective after an extraction is to make sure the bleeding stops, to be comfortable, and to prevent an infection from occurring. So how can we do this? Here are 10 top tips. Tip number 1, apply pressure after the extraction for 15 minutes. To stop the bleeding, bite down on a gauze for 15 to 20 minutes. Before you leave the dental clinic, your dentist will make sure the extraction has stopped bleeding. Your saliva may be bloodstained, but this is quite normal. If your bleeding starts again when you get home, bite on a gauze for 30 minutes without stopping, and if it doesn't stop, call your dentist and they might need to see you face to face. Tip number 2, don't touch the area. I know you can't see inside your mouth, and it can be very tempting to touch the area with your tongue or your finger. This is a big no-no, as you can disturb the clot forming and it will start bleeding again. Imagine you have a cut on your arm and you keep poking it. Every time you poke it, it will be disturbed and it will start to bleed again and again. Tip number 3, take painkillers. Straight after extraction, you may feel like you don't need any painkillers, but this is only because you're still numb from the local anesthetic, which usually lasts around 3 hours. It's really important to make sure you have taken some painkillers before the local anesthetic runs out, as you've just had a procedure done and you do expect some level of pain and discomfort. My advice would be to take some regular painkillers for the next 24 to 48 hours. Taking painkillers can help reduce the pain. For example, if it's at a 7 out of 10 to a 4 out of 10, from a 5 to even a 1. This makes the pain more manageable and allows you to get through your daily tasks and even eating and drinking. Tip number 4, relax for the rest of the day. Don't do anything that can elevate your heart rate, as this can encourage the area to bleed. This is permission to skip today's exercise session, so don't go for a run or do any gym activities or any physical activities. Tip number 5, don't have hot foods or drinks or anything hard. Eating hot foods can cause the blood clot to dissolve and extraction area to start bleeding again. So wait and only eat room temperature foods and drinks for the first 24 hours. Also, eating hard foods like nuts can disturb the area and cause it to bleed again. Therefore, it's best avoided for the next few days. Tip number 6, avoid spitting or rinsing for the first 24 hours. Spitting and rinsing can disturb the blood clot and therefore cause the area to bleed and delay your healing. You may have little bits of blood in your saliva, but the whole extraction site should have stopped bleeding. Remember, it's all your own blood and saliva and you can swallow it. Tip number 7, start salt water mouth rinses after 24 hours to prevent infection. Salt water is a great home remedy with antibacterial properties and can help reduce infections and bacteria in your mouth, and in turn can speed up your wound healing. To make this home remedy, get a cup of warm water and add a teaspoon of salt and mix. Make sure the water is not too hot before rinsing. Aim to do this 4 times a day for the first week, especially after you've eaten. This will help remove the food and debris from the extraction site, therefore helping to reduce the chances of an infection. Tip number 8, no smoking or alcohol for the first 24 hours. This is really important. Smoking and alcohol in the first 24 hours can affect the way the blood clot forms in the extraction socket. This can leave the area extremely painful and is reported to be worse than the toothache in the first place. So remember, no smoking or alcohol for the first 24 hours. Tip number 9, brush your teeth gently tonight. Brushing your teeth is a good idea as it reduces the amount of bacteria in your mouth and therefore reduces the chances of getting an infection. However, if you accidentally hit the area with your toothbrush, as the clot's still young and it hasn't matured yet, it may start bleeding. This evening when you brush your teeth, brush all the teeth properly except the teeth next to the extraction site. This will reduce the chances of it bleeding and causing a problem. Tip number 10, other instructions. Your dentist may give you more instructions depending on what procedure you've had done. If you've had some stitches placed, you may need another appointment for the stitches to be removed. Don't worry, this would only be a short trip. So remember, our main objectives after the extraction are to make sure that the bleeding stops and a stable blood clot forms, to be comfortable, and to prevent an infection from forming. If you've learned something today from this video, like, share and subscribe. My name's Dr. Ilyas and I'll see you in the next one.